Did your baby get stuck during delivery and now you have learned that your child has a brain injury? Want to know what I'm talking about here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a childbirth injury and medical malpractice attorney practicing law in the state of Maryland. And I would like to quickly talk with you today about a condition called shoulder dystocia and how in some instances it can sometimes lead to a brain injury in a child. Now, before I answer the question, I want to jump back and help you understand. You've got to understand, what is shoulder dystocia? Well, essentially, shoulder dystocia is a medical condition in which the baby gets trapped behind the mother's pelvis during a vaginal delivery. This creates an emergency in the delivery room, and understandably so. And that is because what can happen is, as the baby is trapped, the umbilical cord can become compressed. And if the umbilical cord is compressed for a considerable amount of time, then you can have injury to the child's brain. You could be dealing with a fetal hypoxic type of situation. So how can the umbilical cord get compressed? Well, remember, as the baby is coming down, the baby then gets stuck. And if the baby gets stuck up against the pelvis, then the cord can also get trapped along too. And doctors, when they see this is why they have to move quick when there is a shoulder dystocia situation. Because how a brain injury can occur is that, remember, the umbilical cord is giving some very important things to the child, nutrients and oxygen. These things, this is what the umbilical cord is doing. And when you have a reduction in oxygen and nutrients getting to the baby, then it's understandably that a brain injury can occur. Sometimes doctors can see it because the electronic fetal heart monitor, there will be a sudden drop in the baby's heart rate. The normal heart rate is about 120 to 160 beats per minute. But as the cord becomes compressed, sometimes you can see a quick drop in the baby's heart rate. So why have I taken the time today to talk with you about this really important information? Because I'm giving you insight into some of these critical issues that can show up when you are looking at or analyzing a birth injury case. When we are dealing with shoulder dystocia, you have to be very wary of some of these things. Not only can you have an injury to the child's arm or hand, in some instances you can have that brain injury. Maybe you're watching this video today because your baby you've been given a subsequent cerebral palsy diagnosis for your child. Or maybe there's a situation in which you've been told that a word such as hypoxic ischemic encephalopathy, maybe that word has been mentioned to you while you've been talking to your doctors about what's going on with your child and treatment options in the future. Or maybe you've heard the doctors talk about fetal hypoxia, all of these things. So if you do have questions and you would like to speak with me further about what's going on with your child, this is what I invite you to do. And remember, taking this next action costs you absolutely nothing. And what is that action? Pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland childbirth injury and medical malpractice questions just like yours all the time, and I'll be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Take care and enjoy the rest of your day.